views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Well, school is opening, and while there are obvious questions about various vaccination and mask mandates, as well as in-person or virtual controversies, there's also great concern about the mental health and stability of children who have been through quite a lot over the last couple of years. Toward that end, this spring, Mayor Blasio announced a plan to hire 500 social workers to address increased mental health challenges among students. It is a great idea, but according to the Coalition for Behavioral Health and other nonprofits that run mental health clinics in schools, it is not doable as planned. Apparently, the problem is that the pool of social workers to hire does not exist. But tonight's guests believe there is a much less expensive and faster way to do it, and that is to expand the existing school-based mental health clinics that are already established in 243 schools. According to tonight's guests, they can get a new clinic up in about 2 months and provide the same or even better services at half the cost to the city. So tonight we'll talk with them about that, and also to a Bronx principal and a Bronx parent leader. To start, please join me in welcoming the Chief Program Officer of Astor Services, Dr. Todd Karlin. Nice to have you with us again, sir.
Thank you for having me.
The Director of Policy and Advocacy at the Coalition for Behavioral Health, Ms. Nadia Chait. Ms. Chait, nice to have you with us.
Thanks for having me, Gary.
The principal of MS 363, which is the Academy of Personal Leadership and Excellence in Fordham. It is Angelo Ledda. Mr. Ledda, nice to have you, sir.
Thank you so much. Look forward to speaking with you.
Parent leader of Bronx PLAG, which is the Parent Leaders Advisory Group, and that is Rima Izquierdo. Ms. Izquierdo, nice to have you. Thank you for joining us.
Thank you, Gary. Wonderful to be here.
Let's start with you, Ms. Chait. Give me an overview about the difference between starting school in 2020 versus starting school, let's say, in 2019 before we got to where we are. How do you assess how Bronx children are doing, and what do you think they need to do well from a mental stability point of view?
Thank you, Gary. Yeah, unfortunately, of course, there's a significant difference in the mental health of kids, who have gone through the pandemic compared to where kids were before. And even before the pandemic, we weren't fully meeting all children in the Bronx mental health and needs. But now the situation has really reached a pretty critical point. So we've seen an increase of about 25% in ER visits of kids who are experiencing a mental health crisis. We know several thousand children lost their parent or caregiver. And of course, many children experienced unemployment and other events that really harmed their mental health and well-being. And, just their sense of stability, social interaction, all of those sorts of things. So it's really critical as kids are going back to school and as a lot of kids are in school buildings for the first time in a year and a half, that we take the time to really address those mental health needs.
And what would, in a general way, I hate to even ask, what would a perfect situation be to address some of those individual additional issues? And let's face it, many of our children already have issues, whether they live in shelters or come from difficult family circumstances. We know that it's out there. What would be the best way to handle that?
Sure. So, we really think that a model that is very effective are school-based mental health clinics. So you have a nonprofit provider who is in the community, who knows that community, and they partner with a school to put a mental health clinic in the school. And that allows the children in the school to access, the full array of clinical mental health services. And the professionals, those mental health professionals are also able to work with the school to, say, provide a training to teachers on mental health and well-being and, spotting issues with children in their class to send them to the clinic. The clinic can also work with the families. So it's a really robust, well-rounded model for addressing the needs of children.
And where are we at? I don't know, you want to give it a grade? We're talking schools, you can give it a grade. Where are we at in terms of, in general, the city of New York? Of course, we're interested in the Bronx. How well are we equipped to deliver what you are saying?
Well, unfortunately, as you mentioned in your introduction, Gary, we've actually kind of backslid in this area. Oh. So the city has over 200 of these clinics. They've been a really well-working partnership, but we have a big mental health workforce shortage. We just don't have enough staff. And so when the city started hiring social workers to go work for the Department of Education, what they did was actually a lot of those social workers were hired directly away from a school-based mental health clinic. Oh, so instead of, adding social workers, which obviously is a good thing and it is something we totally support, but what we're really doing is just kind of shifting them around, which isn't increasing our capacity, and it's not going to lead more kids to being served.
That is definitely a problem. I feel like right about now, I ought to play the Lone Ranger music. To the rescue. Let's talk to Dr. Todd Karlin from Astor Services. So you have heard what Ms. Chait was talking about. You know about it intimately because you deal with it. What does Astor Services think ought to be done? I mean, listen, the mayor made an attempt, put out an RFP for 500 new social workers. But you guys think maybe there's a better way to do it?
Well, what I really think for this particular situation is a more nuanced approach. When you put all of your eggs in one basket, like let's hire all 500 school social workers, that's more of a one-size-fits-all approach. We know that every school has its own universe, has its own needs. School social workers can do an incredible amount of things, but there are certain things they can't do to provide the higher level clinical services that schools need. So really, sitting down and really putting the power with school administrators, school principals to look at what their resources are, where their gaps are, what the true needs and the unmet needs, mental health needs of the kids attending those schools are. And then finding out the right fit. And that could be a mental health clinic. That could be other providers coming in to provide additional support services, restorative justice practices. It could be stronger links to other community providers, which some have in their community. Unfortunately, like Ms. Chait was saying, this initiative is actually stripping school social workers out of the school-based mental health clinics, which have been put in some of the highest need schools in the community that were already lacking services, which is why they got the school clinics to begin with.
So if you were to look at each individual school, and we know that the schools need support, how do you go around to each school? I mean, I can appreciate you're saying, well, we need to go to each school and provide it for each school. Well, that's nice. And we are going to ask Mr. Ledda to see what he thinks of all that in just a moment. But how do you get around to each school? Does Aster do it? Do you work with a coalition of behavioral health professionals? It sounds like that is the way to do it. You've got a system with, 1,000 schools. How are you going to do that?
Well, when you have to bring all the providers to the table too. Aster's one community-based provider, and I can tell you that when we had the community schools expansion in 2014, we were sitting at the table with over 25 schools and developed 25 new school partnerships that summer. And it was those individual conversations about, tell me about your school, tell me about the kids, tell me about your staff. What are your concerns? What are your fears? What are your needs? What are your resources that you already have to meet these challenges? and where can we be helpful. That nuanced approach is not only, I would say, best practice. I think it's really essential.
It sounds like it would be absolutely essential to this dialogue, to be able to get to individual schools. They have individual problems. And then you said, at least in the materials I saw, that after about 2 months after going through that process with the school, you could help them set up an organization, an office with professionals that could address sufficiently, to some degree, all the students who need help.
Yeah, the school-based mental health clinics are licensed spaces that exist in the schools as a satellite to our hub outpatient clinics. They sort of are a suitcase version of all the services that can be provided in an outpatient clinic, but at the school setting. And what's amazing about that is not only is it a convenience factor for the schools, and not only are all the clinical services on site, the schools also get the clinical supervision. They get all the other auxiliary services that are attached to the provider. And it also works only if the provider and the clinician really become true partners with the school. So that's like attending school-based support meetings, other initiatives, working with the existing school-based support team. It's really that integrated level of care that makes the clinic successful.
And what you say speaks of total logic. I mean, it really makes total sense. Whether there is the resource and know-how how to put that together, maybe we'll get back to you before the end of the show to try and determine that. Mr. Ledda, how are you doing? I mean, I know that you're dealing with an immense amount of issues right now, whether it be teachers who are concerned about health and the health of the students and the various mandates and who is and who isn't. But I'm sure also in your mind is, if a child is not right, it doesn't matter what we do, the child is not going to learn and it's not going to be productive. How do you want to address what you've heard? Do you like what you've heard? Is that possible? Are you satisfied right now with your situation at MS 363? I think we'd all like to hear from a Bronx principal and see how we're doing.
Sure. Thank you. Yeah, and listening to what we've been talking about tonight, I'm fortunate. This is my 15th year now as principal. I've always placed emphasis on the social emotional health and well-being of our students. We even have a school-based clinic that provides support via full service, full-time social worker. But not just that, we also I have 5 counselors on staff and 3 social workers as well to support.
And how many students, sir?
820 students.
800 students. So people would hear 5 and say, oh, what are you complaining about? But if you got 800, more than 800 students, I think we can all understand that 5 is a pretty big load.
Yeah. And I mean, the need for support, even pre-pandemic is always consistent with middle school children in general, but then middle school children, even more so. It's just a very difficult time. And one of the most important things I find is the consistency with providers and the relationships they build with students. I think that is something that is very important. This year coming after the pandemic, knowing that we have students who haven't been in a building in 18 months. So we don't know what to expect. We have to make sure that every adult in the building is taking the temperature of that child so that we can get them the support and service that they need. So starting with advisory first thing in the morning where students are in small groups. And then if it's identified that they need support, then there's a counselor assigned. But I definitely think that having the clinicians in place, whether it's through a school-based clinic, depending on budgets, what is the school allowed or how many can we hire, it's really key to ensure their success because our students are definitely going to need it after all we went through.
Yeah, especially middle school students. I mean, at that age, we certainly, we know that they are having difficulties. Then are you satisfied with what you have? Or did the mayor's announcement, and if they could, do something for it and provide more counselors, you would be happier? I mean, give me you want to give them a grade, however you want to handle it. Give me some level of satisfaction.
Well, I mean, I'm satisfied with the work and that we do here, only because I've always placed emphasis on the social emotional health. So having 4 or 5 counselors now and the social workers we have, I think you can never not have enough counselors or social workers support students. So I think, having the announcement that we're going to hire, but then actually getting the physical people to come in and do the work before the first day of school is very important. Grade wise, B minus, maybe B, somewhere around there. But
All right, fair enough.
getting them into buildings or into these school-based clinics is really the key now.
And what you heard from Dr. Karlin, if that could ever be in place, you would say that is a really good thing.
Absolutely, yes. I mean, again, middle school students especially, but all students, especially in the Bronx, are going to need that support.
Probably we should have begun this dialogue. I thought about it after the fact. We should have begun this dialogue with a parent. And that brings us to Rima Izquierdo. Briefly, if you would, Ms. Izquierdo, define your situation with your children and how you think it's going, or of course you haven't started this school year, or what you're looking for this school year, and then we'll have you evaluate what you've heard so far. So just give us a little personal discussion about you and your family.
Hi, so my name is Rima Izquierdo. I'm a Bronx parent leader. I have 4 children across 3 schools in 3 districts in 4 different settings. I do have 2 children that do receive counseling, and I have 1 that has received it on and off. I do have children with special needs, so I have a lot of experience with families that need mental health supports and services, whether it be for themselves or for their students in support of their situations, their academic needs. Sometimes it's family needs. I am a PTA president at a District 75 school, so I really appreciate the conversation around in-school clinics, because District 75 students in particular tend to be underserved and have really been struggling through all of these transitions and are in dire need of supports and services. I just want to say many students that needed services got related service authorization letters this year, which means that there weren't providers to provide them their services. And families couldn't connect with providers. So I think that the mental health clinics would be a big step in the right direction, particularly for certain demographics of students, to give them that immediate support and that professional level support in a timely fashion.
Prior to this particular time when things are, of course, difficult, were you satisfied? Did you say, oh, good, my child is getting attention and support and better able to function in class and do well? Or were you not satisfied?
So I feel like satisfied is a really relative term. As a parent,
dealing with the school system, don't we know it?
Yes. So I want to be generous, right? So was I satisfied? I think as parents, we're never really satisfied. We're always looking to give our student more and make sure that, when we hit one goal, we're working on the next step and really elevating them. So I don't think parents will ever be satisfied. So I don't want to, be negative, but I also see a lot of areas of opportunity, particularly around mental health services in schools, whether it be better assessing students to identify those that need mental health services, or changing the access to these services, because a lot of families don't know how to make their case for their student to seem eligible for these services. Right. And if you can't prove eligibility, you can't justify providing a service. And that conversation, I think we need to, I think would be mitigated by a clinic, because then a student could just go to the clinic. The providers would be readily available.
A parent would have an easy contact because it would be an organization. So it sounds like your evaluation of what you heard from Dr. Karlin was, gee, that would really help.
I don't think it fixed everything, but it'd be a monumental step in the right direction for those that need it most.
Ms. Chait, just going back to you from a systemic point of view, looking at the city, looking at what you've heard now from a principal and from Dr. Karlin, and also from a parent, what would it take, using Astor Services recommendation, what would it take to get there? I mean, is that possible? Is that legislative work? Is that this mayor? Is that the next mayor? I mean, really, from a policy point of view, sounds reasonable. Gee, a clinic in every school, sure. What would it take? Money?
So it's money, but it's also really the work that Todd described about giving principals and community-based providers those forums to come to the table together and to sit down and work it out. One of the advantages of this model is it is actually less costly to the city than directly hiring their own social workers. The clinics are able to bill Medicaid and other insurance, so they don't need all of their funding to come from the city. So the money on this one is less, there is some money needed, but it's less money than the school social workers. What we really
some of
need
it might be covered elsewhere.
Exactly.
Wow.
Exactly. So what we need is just to come to the table.
Get people to sit around the table and do that. Dr. Karlin, talk to me about what you see, the type of children you see, the kind of issues that you and your colleagues deal with every day. And we're going to go around the room. Mr. Ledda, I'm going to ask you the same thing. So what do you think? What do you see that really needs to be addressed? Like at the grassroots level, what are the issues? Is it children who live in shelters?
I would say it's the children who live in shelters. I think right now my biggest concern, and I think it's been brought up by Mr. Ledda, and I think you referenced as well, the kids who haven't seen the inside of a classroom for 18 months. I think
it must be the happiest kids around, he said sarcastically.
Some, yes. And I think, though, we know we rely on schools for being the gatekeepers for referrals a lot of times. I think, schools are where kids live and breathe. It's where they socialize. It's where they experience challenges, frustrations, successes, and failures. And of course, when you're growing up in a school situation, that's where also some emotional and behavioral issues become present. And when we catch those early and can remediate those early, the kids do much better and are much more successful. One of the things I think we saw throughout the pandemic was a suppression of referrals that existed for a while. And then when kids were coming in and seeking in services, they were already in emergency rooms or they were already in crisis because we weren't catching them early.
Right.
So I think, we're talking about some of the long-term needs that and ways that we can systemically address, the range of mental health services and support them across schools. But I am really concerned about kids coming back to school in crisis, as soon as really now.
I can understand that. One thing that occurs to me about your proposal is the notion of bringing in outside contractors into the school. Administratively, bureaucratically, legally, it starts to become a problem. Do you want to address that? That you think? I mean, the notion that the city can manage something like that, and a new institutional concept scares me, frankly.
Right. Well,
considering the illustrious history of many aspects of our education system.
And the goal is to not do it through large scopes, through a lot of bureaucracy. The goal is to really do it more on individual community partnerships. I think that's where the community school model has, when it's been at its best, it's been at its most successful, because it's connecting. Right now, schools are referring and need connections and relationships to community-based providers for when those outside the school referrals are taking place anyway.
Right.
Sometimes those partnerships don't need to extend in the school. Sometimes that doesn't make sense, but there are cases in which it's really value added. And I really think it's not about getting a clinic into every school. It's about putting choice and logical decision making in the hands of administrators and into the schools.
And yes, it certainly makes sense. Whether it's doable or not, I don't know. Mr. Ledda, maybe you could just talk about the students who you are concerned about. What's the makeup of those students? What is the history of those students that makes you say, you know what, this is what I see so often, and this has to be addressed?
Yeah, I mean, for me, it's definitely, we still have students who are very concerned about COVID and the pandemic. But a lot of the feedback I get from my students, and this is as early as last week when I was talking to some of our kids, is the uptick in violence. And is it safe to come to school? Is it safe to leave my apartment and walk to school? And that's something that's really been on the minds of students. I mean, today was our first day with staff, and we had to have a shelter in because we heard gunshots outside. So, this is something that is, in the reality for our kids. talking about academic.
I just gotta, since I have you here, I have to, and I know it's outside the realm of what we're talking about. Are you in favor of keeping the police force in school, or do you think, as some say, that you would be better off with a school-based security team that reaches out to the police when necessary? Just curious.
I think if it's a school-based team that works with administration and the families and the community that when needed would call 911, I think, again, having more of the mental health providers available, because a lot of our students, the behavior there's a reason behind the behavior.
I'm just moving along because we're running out of time. It's funny how that question is still connected to the mental health of the children. And that gets into bullying, certainly at the middle school level and everything else, right? I mean, it's easy for me to say, what do you think about security? But maybe the answer is behavioral health, where you address that and you don't need all that security, right? Let's get to Ms. Izquierdo. Tell me a little bit about, what you've heard today and what your reaction is for your children, what it is that they really need. And you talked about earlier about going to the next level. How do they get to that next level emotionally?
Thank you for that question. So I want to raise, awareness around the base of students that we initially mentioned, students in transitional housing, students with disabilities. We haven't even talked about students with emotional disorders. These are really the schools that pioneered the way for mental health clinics, because we have an obligation to educate these students, but their behaviors prevent them from that. And I think that model is really fantastic, because now we're in this pandemic where we have all this trauma and all of this mental health. It's like a melting pot of mental health, and now we're not even seeing the full scope of
how dangerous it has been. And you know what I want to add, which maybe you will be able to understand. What you heard from Mr. Ledda was saying that children are afraid to come back to school. Now, number one, we know it's a place they haven't been, for a year and a half or more. And number two, that is the fear, and that creates emotional instability. So some students who might otherwise be okay, they're like, you know what? I'm afraid of this whole thing, as opposed to school being the welcoming place. And it's all part of this whole thing. You called it a melting pot of mental health issues. I think that's advisable. So let's just go around the room real quick. Dr. Karlin, anybody who wants to interact with Astor Services, has questions, wants to support the effort, just give us some contact info and what you'd like people to do.
Sure. You can reach out to our team in the Bronx at 718-231-3400 or contact us through our website at www.astorservices.org.
There you go. And Mr. Ledda, congratulations on your school. And I know you work 24 hours a day. MS 363, you want to just say one thing about your group, the Lions? Is that who they are?
Yes, the Lions. We're excited to be coming back to full-time in person. Want to make sure our families and communities and kids know that we're there for them. We're going to support them, and we're looking forward to see you.
And if you have a group or organization, you want to talk to the Coalition for Behavioral Health, Ms. Chait, how do we find you online? Is that what we do?
Absolutely, yeah. You can just go to coalitionny.org. And if you go to the Our Team page, you'll see the contact info for myself and all of the rest of our staff.
And Ms. Izquierdo, good luck to you and your family and your children. It really is a thrill to have you with us. And listen, I know that you're a parent advocate. Let's get everybody in this room and who's watching TV to listen to parents, because they really know what's going on with their kids, right? Did I say that right? I did. Okay. Okay, that's it. And next week we'll be back with more. Good night.